15 years after Kenya declared HIV and AIDS a national disaster, significant progress has been made in fighting the disease. The latest statistics reveal the national prevalence rate has dropped from 7% to 5.6% in the last 5 years. However, the war is not over as Kenya targets to reduce the prevalence rate to below 4%. Even as the country joined the rest of the world in commemorating the day, concerns have been raised on the need to ensure local sustainable financing of HIV programs as the global financing crisis exerts pressure on donors, resulting in diminishing resources to HIV programs. These concerns took center stage in Machakos County with calls for the government not to limit funding to non-governmental organizations that are key in financing the health sector.
Wanastahili watuongezee msaada ili tupate kuimarisha vita dhidi ya HIV.
At Kenyatta National Hospital in Nairobi County, the hospital's management was expressing concern that despite impressive gain in reducing the national HIV prevalence rate, 50 to 60% of new HIV infections were among the youth, which is being attributed to active sexual engagement and multiple partners.
About 50 to 60% of those are literally within the specific age group, literally 18 to 24. And of those, most of them are amongst girls, the females. And so they are a very strategic group that need to be actually very specifically addressed in terms of empowerment with regards to HIV prevention, but more so even within the context of HIV overall, HIV care.
The hospital organized a walk-in partnership with local university students to raise awareness on condom use among the youth. In Nyeri County, the day was celebrated with calls for safer sex to stem new infections, with county governments being urged to allocate more resources at the grassroots towards fighting HIV and AIDS. Kisumu County Governor Jack Ranguma committed to implementing the HIV framework, even as he called for decentralization of HIV programs. This comes as the Ministry of Health plans to set up a trust fund by next year to ensure funding for HIV programs and non-communicable diseases.